Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left implant. On the panoramic view, you can very clearly see that there is an implant placement done in the mesial root of the lower left six. This implant is very closely, is very placed very deep, close to the inferior alveolar nerve. Just to track the inferior alveolar nerve for you, we're going to start with this region. We're going to zoom in for the doctor. There we go. So this is where the inferior alveolar nerve starts. The marking is with orange. We will move posteriorly towards the first molar. Here you can see the inferior alveolar nerve, and as we are moving distally towards the 7, so mesial root of the 7, you will start to see that the implant appears. The implant is placed center of the ridge, but it is placed compressing the inferior alveolar nerve. This is the coronal view or the front to back view. Here also you will be able to appreciate that the lower left implant is placed quite deep and is definitely entering into the inferior alveolar nerve canal. We can zoom in further right here, and there you will be able to see that this is where the canal is, and then this is where the implant comes in and compresses the nerve canal quite significantly. Now we have taken the nerve marking off for better understanding. This here is the canal right here. You can very clearly see that the implant is well within the canal. Right here, right here. This is the sagittal view. On this view, you can very clearly see that the implant is definitely placed within the canal. We don't know the clinical symptoms, but this is the radiograph finding on the CBCT. Thank you very much.